my name's Andrew Harris. I'm a psychiatrist and I work at the QE2. I work on a service called Consultation Liaison, which is basically looking after people who are in hospital for medical reasons or have had surgery or have cancer or are dying, and looking after their needs from a psychiatric perspective. So, in the course of my job, I will see a lot of different people from different walks of life, some of whom have primary psychiatric illness such as schizophrenias and bipolars. And at other times I see just regular people who've had an accident and have a brain injury, or have recently had a stroke, or are suffering from dementia, these types of things. So I cross some of the boundary between the medical and the psychiatric, and that's one of the things in my job that I find difficult, is that there's this division between medicine and psychiatry. Really, it's historical in many ways, but it helps to build the stigma that psychiatric patients experience, because they're not seen really, even within the medical profession, as having a true medical problem or a disorder or a diagnosis. Oftentimes they're just seen as being weak-willed or unable to cope, or have some personality dysfunction or characterological problem. But in my job every day I see brain problems, brain dysfunction, brain injuries, and so, you know, part of what I try to do every day is educate my colleagues, educate the patients that I see and the families of patients that I see, to understand that the brain is an important organ, and it's the center for psychiatric disease and quite a number of other different disorders. And what we need to do in our planning of a mental health strategy is to actually educate people and destigmatize brain-based disorders and psychiatric disorders and neurological disorders, so that we can understand them better and help people who are suffering the obvious distress.